Measuring alexithymia in autistic people. People vary greatly in their ability to identify and describe the emotions they feel every day. While many people can easily tell when they are happy, sad, angry or frightened, others have great difficulty making sense of their emotional states or describing them to others. People with such challenges are said to have high levels of alexithymia, a personality trait that literally translates to no words for emotions. In addition to problems identifying and describing feelings, people with high alexithymia prefer to focus their thoughts on things they can see or touch, rather than their own or others' emotional experiences, a cognitive style that has been termed externally oriented thinking. Many people on the autism spectrum are familiar with alexithymia, even if they haven't heard the term. Among autistic people, higher levels of alexithymia predict more significant social communication difficulties, as well as mental health challenges such as anxiety. Additionally, research suggests that certain characteristics commonly associated with autism, such as empathy differences and difficulty recognizing emotional facial expressions, may actually result from alexithymia rather than autism itself. Alexithymia, a personality trait characterized by difficulties interpreting emotional states, is commonly elevated in autistic adults, and a growing body of literature suggests that this trait underlies several cognitive and emotional differences previously attributed to autism. Although questionnaires such as the 20-item Toronto Alexithymia Scale (TOS-20) are frequently used to measure alexithymia in the autistic population, few studies have investigated the psychometric properties of these questionnaires in autistic adults, including whether differential item functioning (IDIF) exists between autistic and general population adults. Despite the growing interest in alexithymia in autism research, few studies have looked at whether the tools commonly used to measure this trait work reliably in autistic populations. Our study is part of a broader movement to determine if widely used psychological tools work effectively in people with autism or if new or revised tools are needed. In other recent work, for example, we showed that the Beck Depression Inventory 2 is a valid measure of self-reported depressive symptoms in autistic adults. In the case of childhood anxiety, by contrast, other researchers found that a new assessment was needed for children on the spectrum.